are joined here today. We join here discussing today for a lecture about COVID-19 vaccination awareness with Dr. Sanjay Singh, who is a family physician at Daman Farwania Clinic. So I will let Dr. Sanjay start, please. Thank you.
Okay, thank you, Dr. Danah. Okay, good morning, everyone. It's a pleasure to be here, and thank you for inviting me to take this lecture on COVID-19 vaccination. So, I will use my agenda. I will start with introducing you to the coronavirus, and I will talk on herd immunity and why people are so reluctant to take the COVID-19 vaccination. And I will talk on the vaccination and its workflow in Kuwait. And at the end, I will answer some frequently asked questions about COVID-19 vaccination at my workplace. So what is COVID-19? COVID-19 is a short form of coronavirus disease, which originated in 2019. So coronaviruses are a large family of viruses that were first identified in 1960s. Some coronaviruses cause respiratory illness, ranging from mild common cold to severe pneumonia. Other coronaviruses causes illness in animals only, but can cross the human to humans as it happened in COVID-19. It is referred to as a novel coronavirus, as it has not been previously identified in humans. Due to it being the novel virus, there is no herd immunity and there is no specific treatment. Later in the presentation, I will tell you about herd immunity and its importance. So why is coronavirus so efficient in transmission? If you compare to the flu virus, the common cold virus is almost double in its efficiency of transmission. And the answer to this question is because of the spike protein it has. And why is it called the coronavirus? Because of the crown-like structure it has on the membrane. The image on the left is the real picture of corona, and on the right is a representation. You can see the spikes protein coming out of the membrane, and that's why it helps to attach to the human cell. This is a representative image of the lock and key it forms with the human receptor. The one in red is the spike protein of coronavirus. The one in green is the receptor on the human cell. So after forming the bond with the receptor, the coronavirus injects its genetic material into the human cell. This is the actual photo of the coronavirus being attached to the human cell and is trying to enter the human cell. This is a more graphical picture of image of how the coronavirus attaches to the human cell. And after the attachment, it injects the genetic material into the human cell. Just to add, when you use sanitizers and soap to wash your hands as a preventive method, what it does is it dissolves the lipid layer. It doesn't affect the spike protein, but it dissolves this lipid layer and destroys the virus. That's why it is very important to wash your hands all the time. After the virus has entered the human cell, what does it do? It hijacks the human cell. And just like the photocopy machine, I'm sure you have in your school, it makes millions of copies of itself. Before the human cell dies, it produces millions of copies. So what is a vaccine? Vaccine usually accelerate the immune system of the human beings, and it prevents you from getting sick. So how does the vaccine work? Vaccine usually challenges and it trains your immune system using harmless form of the virus, which can be part of the virus, which can be a DNA or RNA of the virus. So the vaccine activates your adaptive immune response. And the adaptive immune response involves the B cells and the T cells. So these two cells, the B cells that makes a highly specific antibody to stop the virus getting into your cells. And the T cells, it helps stimulate the B cells and it also kills any infected cells. So these two cells remember the virus and remain in the body. And this is the immune memory. They are usually called memory cells. So if you encounter the real virus in the future, your immune system responds faster and more efficiently to prevent the infection. And this is the long-term immunity. So there are many platforms through which we use vaccines. On the left-hand side on this table are the platforms. On the right-hand side are the approved vaccines. So at the moment, we are using 3 platforms to give vaccination, corona vaccination. The inactivated vaccine, viral vector vaccines, and DNA and RNA vaccines. The last one, DNA and RNA vaccines, are a novel approach which has never been used before and has been used for the first time. Examples of inactivated vaccines is the Covaxin that is produced in India, is not used in Kuwait. The vector viral vaccines, example, Oxford Danah, Covishield, and the DNA and RNA vaccines, example, are the Pfizer vaccine. So there are several reasons why there is a hesitancy in the population not to use the vaccine. A study was recently done by Dr. Ayad in Jordan. It was an online study, and he concluded that 81% of the population in Arab countries, they are reluctant or hesitant to take the vaccine. And the top 3 reasons what he found out was that they were afraid of the unknown side effects of the vaccine. And they thought that there wasn't enough time was given to test the vaccine safety. And they thought that the vaccine production was rushed. And of course, there are many other reasons they gave, but these 3 were the main reasons. Now, there's a concept of herd immunity. Why does it matter, your choice, whether you take the vaccine or not? And really it does matters to others. And it matters because of the concept of herd immunity. And here how it works. If you see this picture, the one in blue are not immunized and they are still healthy. The one in yellow, they are immunized and healthy. The one in red, they are not immunized and sick and contagious. So when no one is immunized, the disease spreads through the population. You see the first arrow. The second arrow, when some of the population is immunized, the disease spreads through some of the population. And when most of the population is immunized, the spread is much faster. So at the moment in Kuwait, the level of immunization is less than 1% compared to global population, which is around 2.8%. So how much vaccination, what is the level of vaccination where you can achieve herd immunity? That is the last arrow. For coronavirus, it comes up to 52%. That's what the research says. So you have to reach up to 52% vaccination before the herd immunity can work. And you can see there's still a long way to go. So side effects after getting COVID-19 vaccines are normal. It's a sign that your body is building protection. So if you get fever, pain, you shouldn't worry. That means your immunity is building up. Side effects will feel like a flu and might affect your ability to do daily activities. But it should go in few days. Or you can use paracetamol to treat the muscle pain and fever after vaccination. But it's not advisable to take analgesic or paracetamol before you go for vaccination, unless you get the side effects. So some of the side effects include pain, redness, and swelling. And other effects can be generalized, like tiredness, headache, muscle pain, chills, and fever and nausea. So you can overcome these side effects. You can apply clean wool, cool wet washcloth over the area. You can exercise your arm, and you can drink plenty of fluids and rest lightly to reduce the discomfort. There are two types of vaccination that is given in Kuwait: the Pfizer BioNTech and the Oxford Zeneca. So who should be vaccinated? Everyone 16 years of age and older are eligible to get Pfizer vaccine. But this age is under review by CDC, and very soon this age will come to 12 years by next week, mid-May. And the AstraZeneca vaccine is licensed to be used in people 18 years to 65 years. But recently, WHO in February 2021 approved the use of vaccine over 65 years because it has been seen that the most risk are age above 60 years. Vaccination is important and recommended for adults of any age with certain underlying medical conditions. And these are because they are at increased risk of severe illness from COVID-19. And what are these groups? Example are respiratory illnesses, asthma, hypertension, diabetes, and obesity, and also smokers. There's a long list. The smokers, current or former, they are at increased risk. The risk of severe illness of COVID-19 usually increases with age. Above 40, each decade, there's increase in risk. But those above 60 years are at most risk. Like in USA, most of the mortality were 8 out of 10 were aged above 60 years. The CDC means Center of Disease Control, which is in the US. It recommends that people get vaccinated even if they have a history of severe allergic reactions and not related to vaccine or injectable medication. So if you have severe allergic reaction, it's still indicated to get vaccination. People with the history of allergies to oral medications or family history of severe allergy reactions may also get vaccinated. So what are the group of people that shouldn't be vaccinated? Children below 16 years or 18 years, depending on the vaccination, but currently is under review, it's going to reduce to 12 years. Pregnant ladies and lactating mothers. At the moment, there's not enough evidence for the safety of this category to take the vaccine. But it's still under review because a lot of pregnant ladies that did not know they are pregnant, they got the vaccination, but they did not have any side effects. But research is still going on among pregnant ladies and lactating mothers. The Pfizer vaccine is a mRNA vaccine, and there are 2 dosages, 0.3 mils, within 21 days apart. The Oxford vaccine is a DNA vaccine delivered using a virus vector. There are 2 dosages, 0.5 mils, 28 days apart. But the second dose can also be delayed up to 12 weeks. Usually in Kuwait is up to 12 weeks. So how to register? You can go to this website and register yourself. And simply you will be notified via the SMS in your registered mobile phone about the date, the time, and the venue. So when you reach the venue, there will be an administrative check about your civil ID, and you'll be given a vaccination card. Then you'll be told to follow lines. There are some lines made on the floor to the vaccination hall. And then you'll be guided to the vaccination room. Then the nurse there will check the card and the vaccination to be given. So if it is the first dose you'll be given, you'll go to the waiting hall and be monitored for 15 minutes. And then you'll get the next appointment for your second dose. But if it is your second dose, you will go to the waiting hall, still wait for 15 minutes, and then you'll get your certificate for the second dose. Now, if you are allergic to anything, you have history of allergies, it is recommended that you wait for 30 minutes instead of 15 minutes. So these are some of the sites of the center, the website, the reception. This is where you will be received, and the administrative work will be done. This is where your card will be given. Then you'll follow these lines to your room where they will receive you, where the vaccine will be given. After vaccination, you will receive text message. If it is the first dose, you receive the second dose date or the certificate. So now I'll talk on some of the frequently asked questions I have in my practice. So if these questions answers what you have in mind, your questions, well and good. If it doesn't, at the end you can ask questions. So the first question is, can COVID-19 vaccine make you sick with COVID-19 infection? The answer is no. They are not live viruses. They are either inactivated or dead virus, or they are proteins. So some patients ask, if 97% of COVID patients recover, why do we need a vaccine? This is because complications can occur even in mild or even asymptomatic cases, like the lungs, the brain, the blood. So you need vaccines, and of course to produce the herd immunity. When are you considered to be fully vaccinated? People are considered to be fully vaccinated 2 weeks after the second dose in a 2-dose series. So if you don't meet this requirement, you are not fully vaccinated. And so you keep taking all precautions until you're fully vaccinated. Can I get COVID-19 infection after vaccination? The answer is yes. After Pfizer vaccination is only 95% effective, and Oxford-Zeneca is 91% effective. So what does it mean? 95% effectivity doesn't mean that you are protected 95%. It only means that if you get an infection of COVID-19, the severity will be 95% less. So know the difference. It doesn't mean that it will protect you 95%. It means that if you get the infection, the severity will be lessened by 95%. There are other ones we are not using in QUET as the protective effectiveness. Should I be vaccinated if I already had a COVID-19 infection previously? The answer is yes. Even if you already had a COVID-19 infection, you should be vaccinated when it is offered to you. The protection that somebody gains from having COVID-19 infection will vary from person to person. And we also do not know how long the natural immunity might last. Now somebody asked, I got COVID infection after the first dose. Do I still need to complete the vaccine? The answer is yes, complete the dose schedule. The best is to wait for 14 days after you were either diagnosed with COVID-19 or started having COVID-19 symptoms. When should I receive vaccination if you have COVID-19 infection? That's 2 weeks, but in QUET is given after 90 days. is to give chance to those people that are not vaccinated. Can we stop taking precautions after vaccination? The answer is no, you should continue precautions. Vaccination protects you from getting seriously ill or dying from COVID-19. So for the first 14 days after vaccination, you do not have significant level of protection. And then after 14 days, it gradually increases. Both doses are needed to have the best level of immunity. Now, someone asked, I received only the first dose. How safe am I? So the research has shown that recently that for AstraZeneca vaccination, after the first dose, there is protection of 76% at day 22 from the date of start. So the first 2 weeks to 3 weeks, the protection is less. Each day the immunity increases and reaches up to 76% at day 22. And after the second dose, the vaccination reaches 81% at day 90 from the start date. How quickly would COVID-19 vaccine stop the pandemic? Well, it depends on the effectiveness of the vaccine, how quickly they are approved, manufactured, and delivered, and the possible development of other variants, and of course, how many people gets vaccinated. And now you have heard of some variants that are developing nowadays in different countries. Will COVID-19 vaccine provide long-term protection? The answer is unknown. It is too early to know the duration of protection of COVID-19 vaccine. And research is going on to answer this question. Most people who recover from COVID-19 develop an immunity response that provides at least some period of protection against reinfection. Although we are still learning how strong this protection is and how long it lasts. Now, what are the types of COVID-19 vaccine being developed and how do they work? Currently, there are 7 in use using 3 platforms, as I mentioned before. There are 40 in the human trial stage, and there are up to 150 in preclinical trials. And at the moment, we are using, globally, we are using 3 types, and the first 2 are used in Kuwait. And there are other ones that are protein-based. They are in 28 in development. Is the adverse effect of clot formation of AstraZeneca significant? I'm sure there's a lot of concern about this adverse effect of clot formation. So many patients have asked me this, and the answer is no, it is not significant. Like for AstraZeneca, the incidence of adverse effect is 1.6 to 4.9 per million dosage. Now, if you compare this incidence of clot with somebody having COVID-19 infection, for somebody having COVID-19 infection, the clot formation is up to 45 to 200 per 1 million. So which one is more? So it's better to get the vaccination rather than getting the infection. If you compare to other incidents like clot in general population is 5 in 1 million. Clot in pregnancy is also common, it's 100 to 200 per million. And if you compare being struck by a lightning globally, the chance of getting struck by a lightning is 2 in 1 million. And the chance of having a road traffic accident in Kuwait is 5,431 out of 1 million. So you can see how it's really insignificant, the adverse effect of clot in the vaccines. After getting COVID-19 vaccine, will I test positive for COVID-19 on a viral test? The answer is no. Coronavirus vaccine cannot cause COVID nasal swab PCR to be positive. So if you test positive for a COVID-19, even after being vaccinated, you should treat that positive test as an actual COVID infection. Now, can I have a second dose with a different vaccine from the first dose? Okay, a lot of patients have asked me this. Recently, somebody took a vaccine in China and he came to Kuwait and he was asking whether he can take Pfizer. Or if you had Pfizer, can you take AstraZeneca? The answer is no. You should take the same type, but if the same type is not available, you should take from the same group, like Pfizer and Moderna. Clinical trials in some countries are looking at whether you can have the first dose from one vaccine and second dose from a different vaccine. So there's not enough data to recommend this kind of combination. Do the vaccine protect against COVID-19 variants? Yes, it does. The COVID-19 vaccines are expected to provide at least some protection against new virus variants and are effective at preventing various illness and deaths. That's because these vaccines create a broad immune response, and any virus changes or mutation should not make vaccine completely ineffective. Actually, mutations are taking place millions of times. Mutation really means there is a defect in the reproduction of the virus. So most of these defects are lethal to the virus, but some of these defects, they become mutants and they are more efficient in transmission. So most of these variants that have come up, they are much more efficient in the transmission. If any of these vaccines become less effective against one or more variants, it will be possible to change the composition of these vaccines to protect against these variants. Now, will the COVID-19 vaccine prevent me from infecting others? The answer is no. You can infect others. Just like the asymptomatic people that are asymptomatic, they can transmit the infection to other people. Up to 40 to 70% of population are asymptomatic. They get the infection, but they cannot transmit. Like the difference between transmission of symptomatic and asymptomatic. If somebody has a symptomatic infection, the transmission rate is up to 70-80%. But those that have asymptomatic infection, the transmission is not as much as symptomatic. It's much less, probably up to 40%. So none of the vaccines are 100% effective in preventing transmission. So even if people do not get very sick with COVID-19, they may still get an infection and can potentially transmit the virus to others. If I have allergy to anything, food or drugs, can I take the COVID-19 vaccination? The answer is yes. If you have known allergy to component of the vaccine, you should not take the vaccine. For instance, polyethylene glycol is part of the vaccine. So this compound is found in some food, beverages, toothpaste, shampoos, and medication. And some people have allergies to it. So you need to check it out. If a severe allergic reaction occurs after the first dose, a second dose is not recommended for you. And most of these centers, after the vaccination, you are told to wait for 15 to 30 minutes. And most of these centers are equipped in taking care of any allergic reactions. So how long does the natural immunity last from COVID-19 infection? Natural immunity is the immunity without the vaccination, that is from the infection. Actually, it's unknown, but it's thought to be 3 months. Is the vaccine safe for children? The answer is unknown. Vaccines are usually tested in adults first to avoid exposing children who are still developing and growing. And COVID-19 has also been a most serious and dangerous disease among the older population. And now that the vaccine has been determined to be safe for adults, they are being studied in children. And very soon the recommendation will be from 12 years and above. Which is better, natural or artificial? So the immunity got from natural COVID infection, is it better than the one got from vaccine? The answer is unknown for COVID-19, but some other infection like tetanus, typhoid, the artificial is better. So this research will show subsequently. Will I still need to wear a mask after COVID vaccination? The answer is yes. At least 52 to 82% of the community needs to get vaccinated before the transmission drops enough to stop the using of masks. So a lot of misinformation is going on in the social media. Even yesterday, I got a patient that is 60 years old, and I asked him whether he's registered for vaccination, whether he registered. He said no. He said that he got information from friends and social media that after vaccination, he will die after 3 months. So there's a lot of misinformation in social media. So the onus is on you where to get the accurate information. So always refer to WHO or CDC for any such information. And it's better to do not disperse any information which you are not sure of. So the concluding remarks, I would like to say that vaccinations and not vaccines prevent infection and save lives. And vaccines are important and safe way to control the COVID-19 pandemic, and everyone must do their part and get vaccinated to get back to normal life. And no one is safe until everyone is safe. And I thank you for listening. Any questions, I'll be welcome to answer.
Thank you very much, Dr. Sanjay, for your very informative and very thorough presentation. I've got the first question for you, please.
Yes, Dr. Danah.
Yes. I thought, and it seems wrongly, that percentage which they show for each vaccination is for each vaccine, it's the percentage of protecting us against getting the COVID-19 disease. But it seems, as you said, it's that percentage is about not getting a serious form of the disease, right? So my question is, what's the percentage of each vaccine in protecting us against getting the COVID-19 disease?
Yes, let's take example of Pfizer now. Pfizer, it won't protect you from getting the infection. If you are exposed to an infection, you will get the infection. Now, once the infection gets into the body, there are already antibodies that are in the body, memory cells are there. They are going to take fast action in preventing and stopping the infection getting stronghold in the body. So that is the effectiveness. That's the severity, how fast it controls the infection. Definitely you are not protected from exposure. You will get the infection. It will enter your body. But how fast the memory cells will act, that depends. That's what shows the 95%.
Thank you very much.
You're welcome.
If anyone's got any other questions, please go ahead.
I have a question, Dr. Sanjay. Just when I finish my question and you've answered it, please just go to the chat. There's a question in the chat as well. But my question is, why do some people get more severe? Why do some people get more severe reactions to the vaccine than others?
Okay, you mean?
So a lot of us have had the AstraZeneca.
You mean
a lot of us. Sorry, yes. So, for example, I know that the AstraZeneca gives more side effects than the others because it's based, as you said, on a whole different principle. But some people seem to get more severe reactions than other people. Why is that?
You see, those getting more reaction means that their immune response is more severe. So if you tell me that you are having more pain, I will be more happy than you telling me that you don't have any pain. So the person that gets more of these side effects, the immune is responding more, his immunity buildup will be faster than somebody that tells me that he doesn't have any pain. You get my point? It all depends on your immunity. Like those people that are more aged, their immune response is less. So they will have less pain. Somebody of 65, the pain will be less than somebody of 40 years because the immune response at 40 is more than somebody of 65.
Thank you very much. Thank you. Yes, thank you.
You're welcome.
Hi, good afternoon, Dr. Sanjay. Sorry, Ms. Sadia, go ahead. I will ask later, no problem.
I have mentioned my question in the chat as well. So my question is, here in Kuwait, once you have the Kuwait, you are asked to get a clearance paper. But not for everyone they are asking for it. Like, for example, one of my colleagues get a clearance paper before taking the vaccine, but I was the COVID infectee before. They have not asked me for any clearance paper. Why is it so?
So if I get your question right, you had COVID infection before and you want to get the vaccine and they're asking for clearance from MOH. Am I right?
No, actually, I have received my vaccine as well without getting any clearance paper from anywhere. Whereas some of the people, they are required to get a clearance paper from MOH before taking vaccine. So I just want to clear my doubt that why I was not required to get a paper and my colleagues, they had.
Okay, I get your question. So your question is why some people need clearance and others don't.
Yes.
The reason is the allergic reaction. If on the website you put that you have allergies to anything, then they will tell you to go and clearance. Clearance actually means that you will go to MOH, see the doctor. The doctor will take you detailed history, which are the items you are allergic to, whether it's food, whether it has this particular chemical that is in the vaccine, which I mentioned in one of the slides. Okay, so after getting clear history, then the doctor will give you the go-ahead to give the vaccine, whether to take or not. It's just a safeguard. It's a safeguard.
Okay, thank you.
Welcome, Dr. Sanjay. Thank you. I just have a question regarding for how long does the vaccine? What's the duration of the vaccine? Is it will it be mandatory every year, or every 6 months, or every 2 years, or once in life?
Well, for that we don't have answer for that. Research is still going on, but what I have with me is that probably you have to take it every year, just like the flu vaccine. So it wouldn't last for long. It might. The evidence I have now is 1 year, but we don't know yet. There's no evidence much yet. The WHO and CDC, they haven't have any stand on that.
And if we have to do it every year, do we have to keep with the vaccine that we started off with, or at that point can we swap?
No, we don't have answer to that question, whether you can take a different one or you continue the one you are taking. We do not know.
Okay, thank you.
Taking the vaccine, does that mean you keep your mask on all the time, physical distancing, no gathering, or then what's the role of the vaccine then?
Yeah, that's a good question. If you take vaccine, you still have to follow all the precautions. Now, having a vaccine, you can still transmit the virus. You can still transmit. And
then what's the role of vaccine then?
Yeah, the transmission will be much less than somebody that is not vaccinated or somebody that is symptomatic. So the role of vaccination is to reduce the severity if you get the infection. It will reduce the severity. Number 2, you are contributing to the herd immunity. So the more the people are vaccinated within the community, the lesser the transmission and the lesser the infection.
Dr. Sanjay,
you have to follow all the protection mechanism, all the precautions.
Dr. Sanjay, there is a message in the chat box from my HR department. It says, I need to know if we have allergies like sinuses, asthma and eczema, will it affect the vaccine? Which vaccine has the worst reactions in the long term, Pfizer or Oxford?
Wait, okay, let me read the question again. I need to know if we have. Okay, at the moment, CDC is recommending that even those having allergies, like what you said, sinuses, asthma, they are recommended that they should get vaccinated. And I have many patients that are asthmatic. They went for vaccination and they are well and good, no problem. There wasn't any problem subsequently. On a long term, we do not know. You know, the vaccine is just 4 or 5 months. It was approved by WHO on 31st of December 2020. So it's just 4 to 5 months. So it's too early to say long-term effect of these vaccines. Am I clear, Mr. HR department?
Yes, the HR department they had a problem with their microphone, so they don't think they're able to respond. She said yes, thank you.
Another question, Ravan asked, what about people who are allergic to pain relievers, such as Panadol, Provine, are also antibiotics? Okay, so yeah, we still recommend you to take the vaccination. I have a lot of patients that were allergic to drugs. They took vaccination and they did fine. So even if you have mild reaction, they will take care at the center. They are well equipped. So it's better to take the vaccine than getting the COVID infection. Am I clear? Ravan, is it clear? The absolute contraindication is for the product of the vaccine. The absolute contraindication is if you are allergic to the product of the vaccine. And for allergies to antibiotics is just a relative contraindication. So CDC recommends you to go and have the vaccination. And that's why the centers, they're asking for a clearance from the doctor to go ahead with the vaccine.
Does anybody else have any questions? Speak now, or we need to wrap it up, please.
So I wish to ask how many people on the attendance have been vaccinated?
I have.
What percentage of your school is vaccinated?
I think, yes, HR, oh yes, absolutely. Yeah, 90% of our staff.
Excellent, very good. So you are contributing to the herd immunity. That's good news.
We actually have a herd immunity in our school right now, right? You said it's 52%, so.
Okay, yeah, it's above, the requirement is 52, so you are much above. So the transmission will be quite low, but still you have to take all the precautions in the school, especially those coming from outside. So I'm sure the students will soon, the recommendation will come, those 12 years, maybe soon it will be, the age will be coming down for vaccination.
If there are no more questions, conclude today's lecture. Thank you very much, Sanjay, for your interesting lecture.
My pleasure.
Thank you so much.
My pleasure.
Thank you very much. Thank you.
So I'll be very happy to have more awareness subsequently. Whenever I'll be happy to give more lectures. Thank you, Dr. Danah.
Thank you very much.